Hi guys, my name is Jessica Espinal. I'm currently doing my field internship at Carolina Treatment Center of Fayetteville, located here in North Carolina. The clinic serves patients 18 years and over who have a substance use disorder. So what we do is we offer counseling services to the patients, so individual counseling services and group counseling. The patients are primarily patients who have an opioid use disorder, so they're struggling with, taking illicit Percocets, heroin, fentanyl, along with other substances that may come along like cocaine and illicit amphetamines. So in as an intern, I'm actually doing screenings right now. I have a small caseload of about like 8 patients. I also do group sessions and one-on-one sessions with my new clients. I'm also shadowing a lot of the workers that have a full caseload of their patients, about like 40 patients per caseload. Um, so the reason I chose to take this elective of medical social work is because eventually I would like to work in a hospital setting. I'm not sure exactly what I would like to do in a hospital setting, but I definitely would like to work one on one with providing like referrals to patients and possibly maybe in like the trauma setting. So I'm still debating about that. So what I'm hoping to learn here is again this different roles as a social worker in the hospital setting. Um, just different interventions that workers in the hospital setting use. I know I'm pretty sure some of them are similar to the ones of just the regular clinical social work. Um, and yeah, I'm excited to learn about healthcare and social work practices. So I'm looking forward to learning a lot in this course and seeing you guys and learning a lot from you guys as well. Bye.